Hello, I'm Mary Beth Marsden, and welcome to GBMC's Greater Living Live. Thanks so much for joining us. Today we're talking about something maybe you were curious about, but you didn't know quite who to ask, or you weren't sure that you would even be a candidate for it. Joining us now is Dr. Emily Waters, who is a bariatric and general surgeon, and she's joining us to talk about bariatric surgery and the comprehensive obesity management program at GBMC. Dr. Waters, thanks so much for being with us.
Thanks for having me.
I think this is one of those things, bariatric surgery, that most people have heard about, but still maybe associate with some feelings of old about it or what they heard years ago about it. And they're curious about it, or they know someone who might be interested in it, but they just don't know who to talk to and really what it all entails.
Great. Yeah, that's why I'm here to help answer those questions.
How about if we start super basic? What is obesity, and at what point in our lives might we consider this bariatric surgery as an option?
Right. So obesity, the way we measure it in healthcare is with BMI. So basically, a BMI is a calculation of your height and your weight. If you go online, you can Google BMI calculator, find one, put in your height and weight, and then that'll give you your BMI. So anything over a BMI of 30 is considered obese. Now, to be considered for bariatric surgery, there's a category called morbid obesity. So that's a BMI over 35. So to qualify for bariatric surgery, your BMI has to be over 35 with a comorbidity such as diabetes, high blood pressure, sleep apnea, or a BMI over 40.
So if I had a BMI over 35, but I didn't have a comorbidity or any other issues, I might not be a candidate, is what you're saying, right?
Right, right.
Would I still be a candidate for your program in general with help with my weight?
Yes, I tell people if your BMI is over 35 to still call or contact our clinic. There's a form online that you fill out and then we reach out to you because sometimes there are other obesity related conditions that you may have that you don't even know. So one that I found is acid reflux. So some people who have severe acid reflux and their BMI is over 35, insurance will sometimes cover that for bariatric surgery.
There's so much emotion when we talk about issues of weight. And obviously, lately in the news, a lot has been sort of issues of body shaming and fat shaming and people wanting to celebrate who they are and what their various sizes of bodies look like. So how do we approach this in a healthy way, and how do we talk about when it's okay to be overweight or even obese, if it even is, and how that defines our health and how we see ourselves in this society?
Oh, that's a loaded question there, Mary Beth. So I think, yeah, that's a great question because, there's a lot of people now who are, this is my body. I love how it looks. And that's always great. Like, I never want anybody to feel bad about their body. But I think what it comes down to is your weight having negative consequences on your health? So if you're morbidly obese, then you're going to have a higher risk of getting high blood pressure, diabetes, sleep apnea. Also, there's higher risks of arthritis, like pain in your knees, your joints, cancer, strokes, like heart disease. There's so many negative medical consequences, health consequences of being obese. So I think that those things have to be considered too. I never want to fat shame anybody. That's the exact opposite of what I want to do. I think we should all be proud of our bodies and what we're able to do with them, how we're able to get to work, how we're able to walk around, all this. But we have to be aware of what medical or health things are happening because of our weight.
Also, I think it's probably important for people who feel ashamed in some way of how they look or how they feel even, and they want to do something about it. And I want to dispel some myths about obesity, and especially for those people who don't know anything about it and are quick to say, well, why don't they just stop eating?
Right. Right. And that is, what people will say, bariatric surgery is the easy way out, whatnot, just why can't they exercise and eat right? But really, at a certain point, at a certain weight or BMI, you really can't lose the weight you need to on your own. It just isn't possible. So that's where bariatric surgery really can come in and be a life-saving tool. It's like a jump start to your weight loss. So it's really not the easy way out. And there is a certain point where you can't lose the weight you need to on your own.
I think to look at it, it's not a personal failure. It's something you have and you're struggling with and you need help for.
Absolutely. By the time someone comes to my office, they've tried so many different diets, so many different things to try and lose weight. It's not that this was their first option. And that's something I really want to get across to people. Like, by the time you've come to my office, you've tried up to 20 different diets, exercises, juice cleanses, everything, and the weight just hasn't come off. So, yeah, that definitely is something we see a lot where people have tried so many different things, and this is their last resort.
Someone comes to you and the numbers tell you that they might qualify for bariatric surgery. Then what do you do going forward? Do you talk with them about uh, how emotionally they're feeling about it, what the changes may mean for them other than just physically? How do you prepare someone for this? And then we're going to get into exactly what it is.
Right. That's a great question because it is a life-changing surgery. It's all encompassing. It's not just we do the surgery, good luck, you're on your own, because there's so many different aspects to it. So that's a great part about our program, the comprehensive. It really is comprehensive. We have a great nutritionist on staff, Jana Wolf, who meets with the patients once a month leading up to surgery. Every patient also has to be seen by a therapist or psychologist just to see that they are mentally ready for this surgery.
So when we talk about bariatric surgery, it's not one size fits all, right? I mean, there's a couple different options.
Right. We do two surgeries here. One is the gastric sleeve, and the other is the gastric bypass. And there are certain things that a patient tells me or in their medical history that would convince me to recommend one over the other.
Such as.
So one thing is acid reflux. If a patient has acid reflux, the gastric bypass is better for that. And then diabetes. Diabetes, if you undergo gastric bypass, about 80% of patients come off their diabetes medications. And that's phenomenal because we really don't have anything else in the medical world that can do that.
This is
Another,
go ahead.
I was just say another thing I ask patients is if they're active, if they're able to be active, or they're going to be active. That also helps with my decision making.
And this is probably a poor choice of words to use for this, but is one more extreme than the other?
Well, with the sleeve, you have about a 60 to 70% estimated body weight loss, and the bypass, you get more weight loss, like 70, 75%. But really, you're going to get great weight loss with either. So to me, it's more about what other medical conditions you have that would determine it. And also, patients come in sometimes with preconceived notions about one surgery, like their mom, sister had the bypass, so that's what they want. And if I think, medically that's okay, then I'll let them choose that. That's fine as well.
Okay, let's start with the sleeve. How does the sleeve work?
All right, now we're getting to the good stuff about the surgery part. So the sleeve, if you imagine your stomach about the size of a football, and we take out about 80% of the stomach. So now it's down to about the size of a garden hose, maybe bigger than that. So we take out 80% of the stomach, and so you can imagine that's a lot of restrictive. You're not able to get as much down when you eat. The gastric bypass, we make a small pouch of your stomach. We keep the rest of your stomach in, everything's still connected, and it's a little rerouting of the intestines. So we bring a piece of small intestines up to the pouch and reconnect it down later stream. So there's still a small pouch, small amount of food that can get down. But what's really amazing about bariatric surgery is it's not just about the restrictive or the changing of the size of the stomach that matters. It's a metabolic surgery now. So there's changes in your gastrointestinal hormones, the hormones that tell you you're hungry, that you're full, all those, that signaling changes because of bariatric surgery.
So when you meet a potential candidate and they come to your program and talk with you about it, I'm assuming, look at their individual makeup and what their comorbidities or other issues may be, and then you weigh out the pros and cons of each type of bariatric surgery and make a choice?
Yes. Yes. So we talk about it. It's always a discussion with each patient that I have. What comorbidities you have is number one, because there are some, if you have really bad acid reflux, and you really want the sleeve, I'm going to fight you on that because you're going to have complications from that. And I don't want you to have complications. But if there's other things that definitely number one is medical comorbidities. And then we talk about what the patient wants. Like I said, people have preconceived notions about what kind of surgery they want. And I'm open to that.
Would there be a reason to want the sleeve over the bypass?
I really think it comes down to who in your life has had bariatric surgery and which bariatric surgery they've had. That seems to be the number one thing. And then really there's really no, yeah, there's really no difference between the two as long as your medical comorbidities are okay.
So, and you mentioned that people come in and they have preconceived notions because of possibly family members or people they know, which leads to the question about the genetic component of obesity. Do you see a lot of that?
I see a lot that it runs in families, right? So their mom, dad, brother, sister have had bariatric surgery. So we do see that a lot. And then it's also environment. If you grew up around this environment, then I think that also definitely plays a part.
What other things do you look for in a potential candidate? I mean, as far as age goes, or who might not be eligible?
Oh, yeah, that's a great question. So there really is no specific age limit, but I would say for us, we probably would max out around 75 years old would probably be the safest, just because at that age you may have other heart, lung issues that would make surgery more high risk for you. The other thing, we also don't really do bariatric surgery here at GBMC on patients under 18. That's just, we do mostly adults. And then other patients, I guess if you have to weigh the pros and cons, if you've had a lot of complications in the past, medical comorbidities, issues with surgery, we want to take that because the most important thing is that you're safe. You're undergoing surgery and you're able to go through surgery safely.
Does insurance cover this type of surgery?
It does, yeah, most insurances do. And that's why the BMI criteria, that's really set by insurances because that's what they'll be allowed, that's what they will pay for.
Over COVID, obviously early on, there were none of these surgeries happening, I'm pretty sure. And I'm wondering, I know you're relatively new to GBMC, and welcome, by the way. But I wonder if you noticed sort of an influx of people post-COVID who maybe even their eating was off. Everything was off about their health. And are you up and running at full speed because there was sort of a backlog?
Yes, yeah, we are up and running at full speed. And across the board, every patient I talked to has said, I really gained weight during COVID. That really escalated the weight gain. And that's for several reasons. Emotionally, COVID was really hard, mentally. So people turned to food to cope with that. And then people who are going to the gym or being active by doing activities were no longer able to do those activities. So yes, COVID had a huge impact on our country's obesity problem.
You're definitely in a line of work where you get to see a pretty significant before and after difference in your patients. What is that like? And is that part of what drew you to this type of profession?
100%. That was when I was in my third year of general surgery residency, and we would go to our bariatric clinic, and you would see patients preoperatively and postoperatively, and you could just see the joy, the happiness, the tears of joy that were shed a lot during their postoperative visit because they're able to keep up with their kids. They were able to travel easier. They just felt so much lighter overall. So that was what drew me to it. And it's amazing to be able to be a part of that transformation.
I would imagine that one of the statements you hear so often is, why did I wait so long?
Yes, yes. And, yeah, that's definitely a thought, but also, congratulations for coming. Good for you for getting here, for showing up, and for taking that first step, because it's not easy. It's not easy to tell people who may not, who may still have old stigmas about it, that you're going to do bariatric surgery. So I'm so happy when a patient says, no, I'm ready to do this.
Yeah, there is still some stigma about it, isn't there, out there?
Yes. Yes.
Is it, do you think it's just the thought that you couldn't do it on your own, and so you had to have surgery? There's that sort of underlying feeling, which is just seems good for nothing.
Right. Yeah, it's really I think that's what most people would think, or that's the stigma is like, well, why couldn't you do this on your own? How could you let it get this far? But everybody's journey is different. Like everybody's going through different stuff, and you can't really judge what another person has been through. And then, like I mentioned earlier, once you get to a certain weight, it's hard to lose it on your own. Nearly impossible to do it on your own.
So the surgery itself, how long are you in the hospital for each one of those surgeries? What's the recovery time like? Talk a little about that.
Yeah, so both surgeries, you stay in the hospital usually only one night. It's laparoscopic. We're going to start doing our robotic surgery in the next couple of months. So, but both are minimally invasive, so small incisions for both of them. So people stay one night, they go home the next day. But you're up and walking the day of surgery. You're able to drink liquids, and then it's usually about a week, I would say, a week to two until you're feeling you're same, like this same as you were before surgery.
And what's the pain level like, or what restrictions would you have directly after?
So yeah, that's a good question. The pain, so since it's small incisions, the pain's actually really pretty well tolerated without narcotics. We do local blocks, so put some local anesthetic at the time of surgery into the abdominal wall, so that really helps with pain control. And then activities, we want you walking a lot after surgery, but really no heavy lifting for the first 2 weeks.
So, and this isn't the kind of thing, I mean, this is a rhetorical question pretty much, but it's not where you get surgery and you go home and you're like, hey, bye-bye now. You're going to lose weight and good luck with that. Talk about the commitment after the fact and what massive changes really have to happen in your life.
Right. So this is the importance of the preoperative nutrition education that every patient has to go through. So that's when you meet with our dietitian once a month on Zoom, and that's what you're learning during that time. How is my life going to be different? What am I going to do after surgery? Because you're right, it's not just one and done and then goodbye, see you never. No, it's a lifestyle change. Your eating habits are going to be different. You're not going to be able to eat as much as you were before. Your alcohol intake should be zero. There's a lot of changes that have to take place, and that's why there's 4 to 6 months before the surgery date for you to get ready, for you to start enacting those lifestyle changes.
So no drinking forever, right? This changes that completely.
Yeah,
Um,
you can but way down the line, but not in the first year and a half.
okay, and this is because,
Well, because after bariatric surgery, you metabolize alcohol differently too. So, like after a bypass, really, if you have just a little bit of alcohol, you'll feel drunk. It's just like I said, it's a metabolic surgery, so it changes how your body metabolizes different products.
and then what does the food look like? I know that this is a dietitian question, but I'm sure you have some knowledge of it. What, like when you say the whole eating style has to change, is just really small portions and being very particular about your protein intake and how many carbohydrates and really kind of how restrictive and how difficult is it to manage? Because that's tough for everyone, I think.
Yes, definitely. And it is portion size is going to be a lot smaller just because you're not able to hold as much food as you were before. And that can be really hard for people to mentally change. You're used to eating a full plate, but now it's going to be a lot smaller just because you're going to feel really nauseous or sick or full really early after bariatric surgery. And then protein is a huge thing that we emphasize. You got to get your protein in. And then there is a diet progression after surgery. Like you will be having liquids and protein shakes. And then after that, you'll start eating soft food and then advance from there.
How quickly does the weight start coming off?
Usually in the first 2 to 3 weeks, you start losing some weight and then really probably see the most I would say 1 to 3 months after surgery.
Do you find too that for most of your patients that initial weight loss is enough to sort of really motivate them to continue on and really pay attention to the program, that it's uplifting?
Oh, yes, definitely. That they are definitely encouraged after they see the initial weight loss, and it's a motivation for them to keep going.
If you don't down the road, if you start easing up on your eating plan and you make some bad choices, can you put the weight back on or some of the weight back on?
Yeah, you can regain weight, and unfortunately, we do see that sometimes where patients regain weight after a sleeve or a bypass. The key, though, is to have that conversation if you're the patient who's starting to gain weight with your doctor early on. Say, hey, I put on 5 to 10 pounds. What can we do? Because that's the moment you want to intervene. Go back to the nutrition classes, really dig into like what's happening, why is our diet changing now. So it does happen, but like I said, the key is to intervene early.
Do you, meaning your stomach is so much smaller, your capacity to intake food is so much less, you would really have to work hard at gaining, wouldn't you, to sort of really make choices that are, whether it's high sugar or high caloric or,
Right, because yeah, you if you are taking in small amount of foods, but you can take in really high calorie food, like think of if you drank a milkshake the same size as a protein shake, that's going to be a lot different caloric and fat wise. So yeah, that's one of the things we see that maybe people start eating more dense foods, calorie dense foods.
so, Dr. Waters, as you know, we're live on Facebook right now, and I'm taking some questions live, and we did just get one in that I want to pose to you. And someone was curious about how long would your patients have to see a psychiatrist, if indeed it is a psychiatrist. It may be a social worker or a counselor, but what is that commitment?
So it's just once. And it can be a therapist, psychologist, just like you said, anybody in the mental health space. But there's a form they have to fill out, and it's basically to make sure that the patient is mentally capable and ready to take on the lifestyle changes the bariatric surgery entail. But we do find that a lot of patients want to continue with a therapist, or there may be some emotional eating components or some eating disorder behavior that they really like seeing the therapist for. So that's yeah.
I'm sure it becomes like a family there, and I'm wondering, are there groups too that get together and talk about sort of the issues they've had, or what it's like accepting themselves sort of so changed, and just really dealing with all of it?
Yeah, we do have a private Facebook group for members just who've gone through the program or who are signed up for the program. And that's where a lot of that is saying, like patients can say, oh, I'm frustrated because I started eating this or whatnot, or what advice do you have about this? And the other thing is Jana, like I've mentioned her because she's fabulous, our dietitian. She puts on once a month a Zoom meeting for post-operative patients who've already had their surgery. And I think that's a great time for people to ask questions of things that they've experienced after surgery.
What if someone's watching now and they want to know more, or they want to really get help with figuring out if they may be a candidate or not? What are the first steps that someone can take?
So I would go to our website, gbmc.org/weight loss, and there's a form you can submit on there if you're interested that asks you, about your interest, and then our office will call you to schedule an appointment with one of the surgeons. There's 3 of us here, so and then at that appointment, at the beginning, we do a seminar that really goes into detail about bariatric surgery and all the insurance requirements. So that's really helpful, and then you would meet with us one-on-one.
I mean, bariatric surgery has come so far in these past 25 years, I guess. Is there anything new that you're seeing on the horizon that could change it even more?
That's a great question. There are different procedures that people are doing, such as the mini bypass or SADIs. I won't get into too much technical details, but there are different surgeries that people are trialing that may become more commonplace in the future.
What would you like to see as far as people accepting this type of procedure, embracing it, how to get the word out about the amount of life change that it can bring about?
Yeah, I think I would just like to see more support for bariatric surgery and it talked about more in social media or in groups, so that it's not as stigmatized. Like I said, I think it's come a long ways and it doesn't carry, the stigma that it did before. But I think just to have it more commonplace and it's been really great to have patients, or when I tell people I'm bariatric surgery, to tell me, oh, I had bariatric surgery. Like, I love that people can be open about it because it's something that you should be proud of that you went through and you took that step for yourself and for your future.
You know, this seems like the perfect place to close out, but I just had one more question I have to ask you that I meant to ask sooner. And that is, I knew people too, in fact, who had bariatric surgery, had an enormous amount of weight loss, and had an issue with extra skin that they had to follow up with surgery after that. Can you just briefly touch on that possibility?
Yeah, so that does happen after massive weight loss. You're going to have extra skin. One thing I tell patients is to try to work out, lift weights, try to tighten that up a little bit before surgery. But unfortunately, insurance doesn't cover that. That's a plastic surgery thing where you can get that skin removed under the arms and the belly, the pannus as well. But like I said, insurance doesn't cover as of yet. But yeah, that's something I wish insurance would cover.
That aware that this is a possibility for you with this massive amount of weight loss, and that does happen.
It does happen, but I do, the important thing is that the internal visceral fat that you had, like that's decreasing and your life expectancy is increasing and all the other conditions that obesity affects, like that's improving. And so I know it may be not ideal to have that extra skin, but you have to think about the overall health benefits.
All right. Well, Dr. Emily Waters, Bariatric and General Surgeon, thank you so much for joining us and talking about GBMC's Comprehensive Obesity Management Program. We really appreciate it. Take care.
Thanks.